So we're actually just finishing up with the dental procedure, and we're going to walk you through a little bit of why it takes a little bit of time to get these guys taken care of and what the costs are. So as you can see, our patient is under full anesthesia. He's hooked up to IV fluids. Almost all the anesthesia medications that we use drop blood pressure. And over time, if their blood pressure stays low, that can damage the kidneys for later on in their life. It can affect their brain and other organs as well. So we want to make sure we keep their blood pressure up in a safe level. And the best way to do that is through IV fluids. The other thing that we do is we have a dedicated anesthesia person when we are doing any of our procedures, and that's something that not every hospital does. All they're doing is focusing on anesthesia for that patient, so they can make sure that things go as smoothly as possible. Once we get our patient under anesthesia, they're hooked up to all their monitoring equipment, then we take dental x-rays. That's another thing that not every hospital has. Lots of them do, but not every hospital does. So you want to ask. We'll take dental x-rays that show each individual tooth and the root of those teeth to make sure that we catch any disease that we might not find otherwise when you're just looking at a dog's teeth or a cat from the outside. A lot of times things look really good, but underneath there's quite a bit of disease that's brewing. Once we've got all our dental x-rays and we've evaluated those, then we'll go ahead and clean all that gunky tartar and like concrete type stuff that forms on the outside of the teeth. We'll get all that off and do what we call a scale and a polish, where we're really cleaning all the details of the teeth and then polishing them back. And if you don't polish those really well, then tartar will reform much more quickly later on. Sometimes we have owners asking, they've heard about non-anesthetic dentals, and that's really appealing to owners because they don't have to go through the fear of having their pet under anesthesia. The problem is that when you are really cleaning those teeth from the gums down, all the teeth, the part of the tooth that you can see, that's really just cosmetic. The disease is under the gum. So when you have an animal that's awake and you're trying to scrape underneath the tooth or scale underneath, you're holding that animal down and then using really sharp instruments around their gums. And then the bottom line is that in non-anesthetic dentals, you can't x-ray. So it's really a cosmetic procedure. And unfortunately, that gives the owners the illusion that they've really done something well for their pet. And in fact, it really hasn't made a difference as far as actual dental disease goes. So once we get everything cleaned and polished, then if there are any teeth that need to be removed, we will go ahead and do that. That is a surgical procedure. We can't just pull teeth in dogs and cats. We have to surgically extract them. But we do that in such a manner that they are much healthier in the long run. We have pets that come in and owners aren't really sure that they're in pain. But once we go through this dental procedure, remove all the diseased teeth and get them healed, the owners notice that those pets act 2-3 years younger than they did before the dental procedure. And it's at that point that they realize how much discomfort those pets were in.